Hello everyone, in this basic hematology presentation, we are going to discuss about lymphocyte. Okay, so these are the topics we are going to discuss in this presentation, which are process of lymphocytes production, growth factor for lymphocytes, disease related with lymphocytes, which are HIV, chronic lymphocytic leukemia, and lymphoma. Okay, so we continue to introduction. What is lymphocyte? Lymphocyte is a type of white blood cell. There are roughly production of lymphocyte is 20 to 40% of total white blood cell production. It is fundamental importance in immune response because it can determine the specificity of immune response, either innate or adaptive. The concentration of lymphocyte is higher in central lymphoid organ and tissue, where initial immune response is likely to occur. Okay, next we go to the first part, the process of lymphocytes production. Okay, so lymphocyte originates from pluripotent stem cells, where the pluripotent stem cells can differentiate more of the blood cell, more type of the blood cell, including the red blood cell. Okay, so where we can find these pluripotent stem cells? Okay, in adult we can find it in bone marrows, and in fetus we can find it in yolk sac, liver, and spleen. Okay, the stem cell will proliferate into lymphoblasts and then prolymphocyte before differentiate into natural killer cell and small lymphocytes. Okay, and then the small lymphocyte then undergo differentiation. They are influenced by environments during maturation, which some of the small lymphocyte travel through blood vessels to thymus and mature into T cell, while the remaining will mature into B cell in bone marrow. Okay, so T lymphocyte or T cell will differentiate into more specific T cell. Okay, so the T cell will differentiate into helper T cell, regulatory T cell, cytotoxic T cell, and memory T cell, while the B lymphocyte will differentiate into plasma cell, which can produce antibodies.
Next, we move to the growth factor for lymphocytes. In this subtopic, I will explain about what is cytokines, the role of growth factors in lymphocyte development, and the sources of growth factors. Alright, so what is cytokines? Basically, the growth factor of lymphocytes are mainly from cytokines. Cytokines are vital signaling molecules that control cells' activities in an autocrine, paracrine, and endocrine manner. One of the cytokine family that comprise interleukins such as interleukin 2, 4, 7, 9, 15, and 21 is cytokine receptor gamma chain, which display functional redundancy in the regulation of the immune response and in homeostasis of lymphoid system. Next is the role of growth factors in lymphocytes development. We have many stages involved in lymphocytes development, including stem cell stage, committed progenitor cell stage, and mature cell stage of lymphocytes. In stem cells development, interleukin 7 is one of the growth factors that supports differentiation of hematopoietic stem cells into lymphoid progenitor cells. Besides, interleukin 7 function is to enhance proliferation and survival of lymphoid precursor cells in the bone marrow and in the thymus. Next are B cells growth factors. Interleukin-4, which is known as BCGF1, is growth factor that stimulates activated B cell proliferation and the differentiation of B cells into plasma cells. It also induces B cell class switching to IgE and upregulates MHC class II production. Besides, interleukin-21 promotes the terminal differentiation of activated B cells into plasma cells. Thirdly are T cells growth factors. Interleukin-2, or known as TCGF, functions in promoting the differentiation of T cells into effector T cells and into memory T cells when the initial T cells is also stimulated by an antigen, thus helping the body fight off infection. It also promotes the differentiation of certain immature T cells into regulatory T cells, which suppress other T cells that are otherwise primed to attack normal healthy cells in the body. The second T cell growth factor are interleukin-7, which stimulates the survival of naive and memory T cells homeostasis in the periphery. Next, for natural killer cells or NK cells growth factors, interleukin-15 acts as a crucial element to regulate the activation and proliferation of natural killer cells. Besides, interleukin-12 enhances NK cells to release interferon gamma and display strong cytolytic activity against tumor cells or immature dendritic cells. Interleukin-21 also assists in promoting the terminal differentiation of interleukin-15 activated NK cells. Lastly is the sources of growth factors. For interleukin-2, it is produced by activated CD4 plus T cells in secondary lymphoid organs, while interleukin-4 is produced primarily by mast cells, T helper II cells, eosinophils, and basophils. Besides, interleukin-7 is produced by thymic and bone marrow epithelial and stromal cells and by reticular cells in peripheral lymphoid tissues. Interleukin-15 is produced by different non-lymphoid cell types such as monocytes, dendritic cells, and stromal cells of the bone marrow and thymus. For interleukin-12, it is naturally produced by dendritic cells, macrophages, neutrophils, and human B lymphoblastoid cells in response to antigenic stimulation. Lastly, interleukin-21 is secreted by CD4 plus helper T cells, particularly follicular helper T cells.
The first disease related to lymphocyte is acquired immunodeficiency syndrome, which is AIDS. AIDS is a type of acquired immunodeficiency that is caused by HIV, where HIV was known as lymphadenopathy-associated virus LAV at first, and then being referred as human immunodeficiency virus. Etiology of HIV, where in 90s may believe that no infectious retroviruses being found in human. And then in 1980, the first human retrovirus named HTLV1 was isolated. And in 1982, HTLV2 was isolated. In 1983, HIV was isolated from a homosexual man with lymphadenopathy, and the American research team isolated the same class of virus which was labeled as HTLV3. When it was demonstrated that LAV and HTLV3 were the same virus, an international commission changed the name of the virus to HIV. And in 1985, HIV type 2 was identified. Where the relation of this disease with lymphocyte is when HIV present in body, it will cause suppression of CD4 plus cell below 200 cell per ml, where the normal range is 500 to 1500. It is not only CD4 cell that has CD4 antigen embedded. It also have in macrophages, lymph, monocyte, and other organs. This HIV is transmitted through human's body fluid through many routes of transmission, such as pregnancy, sexual intercourse, sharing needles, syringe or injection equipment, and contaminated blood transfusion and organ transplant. This is how the HIV works. The HIV will attach to the host CD4 cell, and then it will enter the cell, and the HIV's RNA will undergo reverse transcription to form DNA, and the DNA will integrate with the host DNA to form a new DNA, viral DNA that will form viral complement, and then this will form HIV virus, and then it will multiply more and more, and then will be released and will be spread throughout the body. This is the early phase where the infection is completely asymptomatic for years, and it may have some symptoms such as flu-like illness, fever, and skin rash. 2 weeks to 3 months after acquired infection, symptom-free for years, CD4 cells still high enough and can fight the HIV that invade the body. So that's why it is asymptomatic. In late phase, the CD4 cell level drop below 200 cells per ml. System can't function well anymore. The average takes around 8 to 9 years pass by it's fully developed. The symptoms may be fever, multiple secondary infections, opportunistic infections such as Kaposi sarcoma, PCP, B-cell lymphoma, tuberculosis, pneumonia, Wilson syndrome, and more. HIV test, we have 4 types: acid test, antigen antibody test, HIV antibody test, and rapid at-home test. What is nucleic acid test? It detects if the person have infection after 10 to 33 days of exposure to HIV. Is drawn from vein and from the blood bodies, know how much is present in the blood. And then it is expensive but routinely used for screening individuals. Result will be obtained around few days. To screen donated blood or test newborn suspected of having HIV. One is antigen antibody test. It detects if the person have infection after 18 to 45 days after exposure. Blood being taken from vein and taken to the laboratory for further analysis, where antigen P24 is detected. It is antigen P24 is produced when HIV present. So using this test, this antigen will be detected. If the blood taken through fingerprint, it will take longer duration for indication. Deliver preliminary result in around 20 minutes. HIV antibody test. It uses blood from vein also to detect HIV soon after infection. It is the most rapid test. It detects HIV sooner after infection and the result obtained 5 to 10 days. It has many ways. Can be from fingerprint or oral fluid, but the blood from a vein is sooner than HIV. One is rapid at-home test, whereas saliva-based antibody test that can be purchased at many drugstores. It is less accurate. It is the same as antigen antibody test, where it detects the antibody, but it is less accurate and result obtained within 20 minutes.
Chronic lymphocytic leukemia. What is chronic lymphocytic leukemia? It is actually a type of blood cancer that caused by overproduction of abnormal B lymphocyte cell by bone marrow. This condition characterized by accumulation of B lymphocyte in blood, bone marrow, and secondary lymphoid tissue. Researchers also found that genetic mutation may contribute in abnormal production of B lymphocyte. The specific gene affected is uncertain, but in the most cases of CLL, chromosome 11, 12, and 17 detected to undergo deletion. This condition may affect the DNA of blood-producing cells. Signs and symptoms: enlarged painless lymph node caused by the accumulation of abnormal lymphocyte that most often occur on the neck and also armpit. Fatigue. As CLL will increase inflammation, it will make a person become more tired. CLL also may cause unexplainable high fever above 38 degrees Celsius. Abdominal pain caused by the enlarged spleen or lymph nodes or development of CLL on the lining of stomach or intestine. Weight loss. Frequent infection. There is less healthy lymphocyte than abnormal lymphocyte, which also weak at fighting infection. Predisposing factor. Age. Researchers found that older people, especially in their 70s, are more likely to develop CLL than younger people. Race. White people also found to develop CLL more likely. For example, this disease is common in North America and Europe than Asia. Researchers also found that the genetic makeup of white people also contributed to the occurrence of this disease. Family history. People with family history of blood and bone marrow cancer had increased risk to develop this disease. And lastly, chemical exposure. For example, during the Vietnam War, herbicides and also pesticides had been used, and it is suspected to be linked to the development of CLL. Complications. Immune system abnormalities. CLL may cause the disease-fighting cells of the immune system to mistakenly attack the red blood cells or the platelets. Develop more aggressive form of cancer. Patient diagnosed with CLL may develop diffuse large B-cell lymphoma, which is fast-growing lymphoma. Increased risk of other cancer such as skin cancer, lung cancer, and digestive tract cancer as their immune system weakened. Treatment. Watchful waiting or observation. Patient's condition will be monitored closely without giving any treatment until signs or symptoms appear or change. It is used to treat asymptomatic or progressive CLL. Targeted therapy. Treatment that uses drugs or other substances to identify and attack specific cancer cells. Some of the therapy used are tyrosine kinase inhibitor therapy, which it will block tyrosine kinase, which has function to develop more white blood cells. BCL2 inhibitor therapy, which it will block BCL2 that found on the leukemia cells and may kill the leukemia cells and make them more sensitive to any anti-cancer drugs. Medications. Alemtuzumab. It is actually a monoclonal antibody that selectively binds to CD52, which highly expressed on lymphocytes, and this action will deplete excessive B and T lymphocytes in peripheral circulation. Unfortunately, the exact mechanism of this medication is unknown. Chemotherapy, a treatment that uses drugs to stop the growth of cancer, either by killing or stop them from dividing. It could be taken by mouth or injected into a vein or muscle and will be directed into the bloodstream. Radiotherapy. It is a treatment that uses high-energy X-ray or other types of radiation to kill the cancer cells or keep them from growing. In the case of CLL, external radiation therapy is used, which is a machine outside the body will send radiation toward the area of the body with cancer, such as group of lymph nodes or the spleen. Immunotherapy, which is a treatment that uses patient's immune system to fight the cancer. Substances were made by the body or made in laboratory are used to boost the body's natural defenses against cancer.
Lymphoma disease. Cancer that begins in infection-fighting cells of the immune system. Lymphocytes change and grow out of control. There are two types of lymphoma. First, non-Hodgkin lymphoma. It develops from B and T lymphocytes in the lymph nodes. It may not affect every lymph node, often skipping some and growing on others. 2. Hodgkin lymphoma. It presents of red-chambered cells, abnormally large B lymphocytes. Cell cancer moves from one lymph node to an adjacent one. The causes begins when lymphocyte develops a genetic mutation. The mutation instructs the cell to multiply rapidly and resulting in a large number of diseased lymphocytes that continue to multiply and survive when other normal cells would have died. It causes too many diseases, ineffective lymphocytes in the lymph nodes and swelling of the lymph nodes, spleen and liver. There are 4 factors. Age, more common in young adults and also people over 55. Being male, males are slightly more likely to develop than female. Impact immune system. People with immune system disease or take drugs that suppress immune system. Next, developing infections. Epstein-Barr virus and Helicobacter pylori infection. There are few symptoms. Painless swelling of lymph, persistent fatigue, unexplained weight loss, itchy skin, fever, shortness of breath, and night sweats. Diagnosis: blood test to count number of cells, bone marrow for testing, imaging test, CT, MRI, and positron emission tomography. Physical exam: swollen lymph nodes in neck, underarm, and groin, spleen, and liver. Removing a lymph nodes biopsy procedure for laboratory testing. After that, treatments: biologic therapy, antibody therapy, chemotherapy, radioimmunotherapy, radiation therapy, stem cell transplantation, steroids, and surgery.
In conclusion, lymphocyte is a type of leukocyte or white blood cell, which also known as the main type of immune cells. Production of lymphocyte will be originated from pluripotent stem cell, which will occur in yolk sac for fetus, bone marrow for infants, and various sites such as vertebra in adults. This stem cell will be then differentiated into more specific cells such as B and T lymphocyte. During its production, there are various growth factors involved, which mostly categorized as cytokine, such as interleukin-7, interleukin-2, interleukin-4, and more. These cytokines had their own function to support the production of lymphocyte cells. Unfortunately, abnormality of lymphocyte also could be related to some diseases such as AIDS, chronic lymphocytic leukemia, and also lymphoma.